body fluid distribution and measurement. This is also repeatedly asked with giving the numbers also and the distribution amount also we should know. So in the human body, almost 60% of the total body weight is about water. Like 60% of the entire human body is water. In premature infants, it is almost 90%. In mature infants also, it is around 80%. So major content in the body is of water. So coming to the total body water distribution, how it is distributed? It is distributed into various compartments in the body. So coming to the total body water, it is 60% of total body weight. Then it is primarily divided into intracellular fluid and extracellular fluid. These are the two primary divisions. The intracellular fluid, there is millions and trillions of cells in the body. That's why the intracellular fluid is more than the extracellular fluid. The intracellular fluid is around two-thirds of the total body water. Is around two-thirds of the total body water, which is around 40% of the body weight, because this 60, the 60%, two-thirds will be 40% and the remaining one-third will be 20%. So the extracellular fluid is the remaining one-third, which is around 20% of the body weight. Suppose if body weight is given, then ideally you just have to multiply it with the factor that is needed. And if body weight is given, for example, 70, and it is asked what is the percentage of the ECF, then you can easily tell that 70 into 0.2, which will bring us to 14 liters. So this is the normal value also. So it is easily calculatable. Then the extracellular fluid is further divided into interstitial fluid and plasma. Interstitial fluid takes most of the part, that is the 3/4 of ECF is taken by the interstitial fluid, which brings around 50%, 15% of body weight. Here we have seen that the total ECF is 20%. 3/4 of 20% is 15% of body weight. Then plasma, it is around 1/4 of the ECF or 5% of the body weight, because total ECF is 15 plus 5, which is 20%. Then the classical example given is what is the body water distribution in a 70 kg male. You just have to remember these values. It is the commonly asked question, because 70 kg is taken as a standard adult. So 70 kg, 60% will be around 42 liters. In a 70 kg male, 60% is 42 liters. Out of that, two-thirds is ICF. So around 28 liters is ICF. Then whereas the ECF is one-third of that, which is around 14 liters. In this 14 liters, 3/4 will be 10.5 liters for the interstitial fluid. Then plasma is around 3.5 liters. We just have to remember these values, and it is very easy for us to mark the MCQs. Now coming to the measurement of compartments. How we are going to measure the particular compartment. Suppose if you want to measure in ECF, ICF, we need some of the dyes or substances which are staying in the particular compartment. The first rule, it should not be toxic, non-toxic, and whichever substance I am using, it should stay within the particular compartment. Stay within that compartment. It should not go to the other compartment. If it goes to the other compartment, then we cannot measure it. So coming to the substances used, we have to just remember all the substances used, because various MCQs can be asked from here. So the total body water, it is very easy to remember. Total body water we have to measure. So we have to use something similar to that water. We are using the other forms of water, that is deuterium, then tritium and antipyrine. All these three substances can be used to measure the total body water. Then coming to the ICF, ICF cannot be measured directly. Why? Because we cannot take out our water from all the cells and take out water from one cell and consider it as a representative. So it is a humongous task which cannot be done. So ICF is measured indirectly. How ICF is measured? We can measure it like total body water minus ECF, because ECF is easily measurable with some substances. The standard most substance used is the inulin. Inulin is a substance which is consistently used for the ECF measurement. Then other substances which are used are sucrose, sodium, then iothalamate, radioactive sodium and iothalamate. These are the other substances that is used. For example, if they give what is the substance used to measure ICF, they will be giving in options of these two substances, deuterium and inulin, because when I measure the deuterium, it gives me the total body water. When I measure the inulin, it gives me the ECF. So finally, ICF can be calculated. Then in a similar manner, interstitial fluid cannot be calculated. How do you calculate it? Like we cannot measure it directly. We can calculate it from ECF minus plasma. So for plasma measurement, we should need some substances, and the classical substances used are Evans blue and albumin, because albumin stays in the plasma. So because of this, we can use these two substances. They can combine two substances and ask which can be used to measure ISF, that is the interstitial fluid, like giving the options like inulin and Evans blue. So these are the standard forms of question that can be asked with this respect to these substances. Then coming to the another important distribution, we have seen the water distribution, but we should also know the ionic distribution in ECF and ICF. This is the ECF and this is the ICF. This is very easy to remember. We just have to remember some history. All the mammals and the animals are developed first from the seawater. So what was happening is there was a unicellular organism which was exchanging the substances with the seawater. So the seawater was acting like an ECF for the organism. So obviously what is there in the seawater? All of you would have gone to beaches and it is very salty. So the ECF primarily contains NaCl, that is nothing but our salt. So once you know this concept, it is easy to remember the cations and anions which are maximum in which compartment. So coming to the cations, the maximum cations which is present in ECF is nothing but our sodium. And they will ask you about one more substance which is more in the ECF, which is calcium. So these are the major cations of the ECF. What is the major anion? Already we have seen, it is salt, NaCl. Another anion which is maximum in the ECF is, if you study about the respiratory system, there bicarbonate is transported maximally. So this bicarbonate is the anion which is transported maximally in the ECF, and that forms the major anion of the ECF. So we are done with our ECF. So coming to the ICF, which is the major cation here is potassium. That's why the sodium potassium pump constantly acts to maintain the cell shape and size. So potassium is the major ion. Then we also have the magnesium. Since they are both with potassium, they are asking about magnesium and the calcium. You should remember, calcium is maximal in the ECF, magnesium is maximal in the ICF. Then which is the major anion present in the ICF? We have the phosphates and proteins. So this table should be remembered, because there was a recent question about the magnesium. Magnesium is maximum in the ECF or ICF, it is maximum in the intracellular compartment. So this is very, very important.